helping especially my younger colleagues discover their purpose in life and be true to their calling.
Okay. And I like that introduction.
Yes.
Okay, you are actually dedicated to serving children who are living with the burden of pain that is brought about as a result of arthritis, among other challenges. All right.
Yes.
So, Daktari, you are here to help us understand more about young rheumatic disease.
Correct.
Okay.
Yes.
When we talk about rheumatism, first of all, what does it mean?
So, the way our human bodies have been created, all our organs and structures are held in place by what we call connective tissue.
Okay.
That's why, you know, the heart and lung that is in the chest is not just floating anyhow, it's in position because there are structures that keep it there. You know, when we look at our skull, there are many structures in there, and everything is held in place by what we call the connective tissue. Now, diseases that attack the connective tissues is what falls in the bigger category of rheumatology diseases.
Okay.
Yeah. Now, this connective tissue not only holds things in place, but allows you, as you're in motion, for these structures to still remain in place.
Okay.
So that as you move from your chair to the kitchen, or from the kitchen to the bus stop, you know, your lungs and your heart will still be in place. So some of the common or well-known connective tissue includes the muscles, includes the bones, and even the ligaments that hold your joints in place.
Okay.
Yes.
Well explained.
Yes.
And you know, as you are explaining these muscles, these ligaments, these bones, we believe that as I age, all right, there is also wear and tear.
True,
okay, there is a very likelihood that the Bramwel you are seeing now will not be the Bramwel in 70s when we meet. Okay, but now the irony is we are talking about young rheumatic disease.
Correct.
What exactly does that mean?
So young rheumatic diseases, these are conditions where when the body is functioning well, not just in the children, but even in adults, we have a natural defense system. And you can think of it like the KDF of your body.
Yeah.
And in medicine, we call it the immune system. If your natural defense, if your KDF is working well, its core function is to protect you from all the germs out there that cause disease. If there are any abnormal cells, you know, it's in your body, it can get rid of it.
Yeah.
But most of the time in rheumatic diseases, that natural army, that KDF that God has blessed you with, gets confused. It gets confused to the point that instead of focusing its efforts to fight the germs that cause disease and remove those abnormal cells, it now starts fighting and attacking the normal parts of the body. Okay. So you see that there's a confusion. Yeah, the army is not supposed to fight the citizens. It should fight the invaders. So imagine now your natural army getting confused and attacking your body. That fundamentally is the problem with the entire spectrum of the rheumatology diseases we treat. So this confusion is not just limited to adults.
Okay.
The confusion can also happen in children. In fact, the youngest child I've seen in my practice with arthritis was a baby who was 10 weeks old.
10 weeks old?
10 weeks old. It's just to show you that the confusion in the army can start as early as that age.
Wow.
Yes.
And talking about 10 weeks old, Daktari,
yes.
is it something parents should genuinely worry about?
Yes. It should concern any guardian, be it a parent, a teacher, or grandparent. And why should we even be talking about childhood rheumatic diseases? As I said in the beginning, the first person of focus or contact is that child, because they are now burdened with pain.
Yeah.
Right? And sometimes they can't explain themselves the way you and me are speaking.
Mm-hmm.
So like in the case of that 10-week-old baby, what helped is what I call the ministry of presence.
Okay.
That guardians, it's fundamental that we are present. Because when you're present in the lives of your children, then you can observe. So in this case of the 10-week-old baby, what helped is that the mother noticed the baby is not moving the right leg.
Mm-hmm.
Even when she places the baby down, that right leg never moves. And she wondered what is going on.
Yeah.
And that's when she came forward. Then we realized the child had arthritis in the knee.
Mm-hmm.
So if we don't address this, these children are carrying the signature of pain. When you speak to people who are involved in child development, that even changes the functioning of your brain.
Mm-hmm.
After all, who should be living with pain? It's not fair, isn't it?
Yeah.
In addition to that, then there's the risk of disability. Because now what's happening, your natural defense is fighting the joints, for example.
Mm-hmm.
So as it fights, it's releasing weapons.
Yeah.
And as the weapons are being released, they are destroying the joint. So what does that mean? That joint is completely crushed, completely destroyed. You're now going to start talking about joint replacement. Okay. Now remember, this is a child who is growing.
Yeah.
They're not like you and me, our fate is sealed.
Yeah.
Yeah. This is a child who is growing. So imagine if you have to replace that 10-week-old baby, if you have to replace the knee. When they're 2 years, you're going to do another operation. When they hit the teenage years, you have to do another operation. That is the tragedy of not responding in time. That's just at the level of the child. Mm-hmm. Now you come to the level of the parents and the family. The number of several visits that they are doing, time lost from their workplace, because of misdiagnosis, the loss of resources, being sent for tests that don't mean anything. I've had children who have been put on cancer therapy because they thought it was cancer. Another one was put on therapy for TB for 9 months.
Look at that.
And most of our drugs, if you're given a drug that you don't need, there's potential of poison in the liver.
Exactly.
Poison in the kidney.
Yeah.
Then think of the burden on the health ecosystem. Somebody hop, skip, and jump from one hospital to another. Mm-hmm. Trial and error of different tests and medicines. At the end of the day, it costs us heavily. Not to mention the risk of losing these children because of a disease that has been misdiagnosed or not treated well.
Look at that. The pain is so severe.
Yeah.
And Tari, you've mentioned about this confusion or this army attacking the joints. So is it a problem of the joints only or can it affect other organs?
That's a really good question. So, as I mentioned earlier, the connective tissue that holds our organs in place is quite vast. And part of the structures that are involved in that connective tissue, like I said, includes the bones, includes muscles. So there are some children who come to us with weakness, And I remember a case where this child, the mother, again, you see the ministry of presence.
Presence, yeah.
The mother noticed there's something wrong with her daughter because now she was not washing dishes. She can't write the school notes. When she went to the initial doctors, they said, no, this child is pretending because of the family conflict. She said no. But she went on Google, looked for doctors who handle children with weakness.
Yeah.
And she eventually landed in our facility at Aga Khan University Hospital, and we actually made a diagnosis of something we call myositis, where the army attacks the muscles. So now your muscles have no power. So the connective tissue can involve joints, and when those joints are attacked, it leads to arthritis. Can involve muscle. When that's attacked, it leads to something we call myositis. The other structures that are involved in this big bracket are actually the blood vessels. Okay? Yeah. And I remember a case we managed at Aga Khan University Hospital of a 9-month-old baby who presented with stroke because the natural army attacked the blood vessel. When the blood vessel was attacked, it ruptured, and that's what stroke is.
Yeah.
That blood vessels in the brain either rupture or are blocked. So imagine a 9-month-old baby presenting with stroke.
Stroke.
Yes. So these are just some of the conditions as rheumatologists we treat.
Wow. And Daktari, talking about rheumatology, rheumatic disease, yes. Is it related to immunity?
Very, very closely related. In fact, I tell the younger doctors the future of medicine is actually two very key disciplines. Immunology, which is the study of our natural defense system. So our natural defense system is called the immune system. Yeah. So when you talk about immunity, that's the core of what we normally tackle, because your defense has gone rogue. It is confused. It is now attacking your body. Then why genetics is important is because your immune system is often under instructions. And these instructions are embedded in a unique code, which is actually what constitutes our genetic makeup. Yeah. So for example, if your eyes are brown, they are brown because your genetic code, which is in your genes, dictates your eyes will be brown. Yeah. You understand? Yeah. This is why when you go to hospital, you find sometimes people ask you, does anyone in your family have hypertension, diabetes? What we are indirectly trying to get is there a possibility of a genetic risk that puts you at risk of getting some of these conditions?
Okay.
Yes.
Wow, now I understand even better. Now, let us look at now this particular disease now broadly.
Yes.
What are the most common rheumatic diseases you see in children and young people here in Kenya?
So, our observations in Kenya actually mirror a lot what people also see across the world. And this is important because sometimes there has been a misperception that our children don't suffer these diseases. Yeah. Now, the leading disease or leading condition is what we call juvenile idiopathic arthritis. This is arthritis that typically affects children. It begins at the age of either 16 or younger. So when it begins is very key, because if you come to me at the age of 17 with your joints swollen and painful, I gently just shift you to the adult colleagues. Yeah. So it typically begins at the age of either 16 or younger, so anyone from 0 to 16. That is the top. And it is estimated for every 1,000 children, you can have between 5 to 40 of them having arthritis. And when we look at our Kenyan population, about 50% of the population are children. Yeah. That's why, as pediatricians, we say one of the best investments is to invest in children.
In children, sure.
Yes. Yeah. Given just the demographics. But anyway, so if you look at the population of our country, we are about 50 million, and half of that are children, so about 25 million. So potentially there are between 200,000 to 300,000 children out there living with the pain and disability that comes with arthritis. So that's one. The other common condition is what we call lupus. Now, you see, in arthritis, your army's attack is focused on what? The joints.
The joints, yeah.
Now, lupus is another conundrum. In lupus, what happens? Your natural army decides to attack everything from head to toe.
Okay.
So these are children who initially can present with loss of hair. They can sometimes present with poor school performance. Others present with wounds and sores in the nose and mouth. Others have very peculiar skin rash that doesn't respond to typical medicines. Others come with heart failure, liver failure, kidney failure. They can also present with arthritis. I mean, it attacks every organ and structure from head to toe. And lupus, in our context, is actually more aggressive. It is estimated of all the lupus patients in the world, 20% are children, and in children it is more aggressive than in adults. So that's the second. Then the third is what I described earlier. You can have an isolated attack purely on the muscles. That one we call those conditions myositis. And they typically present with weakness. They can't climb stairs, they can't pick something from the shelf above, when they sit on the toilet, or they go to the pit latrine, when they squat, they cannot stand up. And then the other one that's common is what we call the vasculitis. In vasculitis here now, your natural army focuses on attacking the blood vessels. So they can have a red spotted rash. They can even present with heart attack. Because, blood supply is needed to supply the muscle that pumps the blood in your heart. Or, as I said earlier, they can even present with stroke, because the blood vessels in the brain have been attacked. Yes.
Wow. And talking about children, Daktari, are boys and girls affected equally?
It depends on the condition. So, for example, when we look at the patients we see with juvenile idiopathic arthritis, most of them are actually boys. Especially, there's one particular group of arthritis that not only attacks like your wrists and your knees, but also attacks the spine. Because your spine is made of bones. And a joint is the communication or the connection between bones. So there's a particular arthritis, we call it spondyloarthritis. I know those are very long names, but just remember, arthritis not only attacking the wrists and ankles, but also the bones of the spine. Then when you look at a condition like lupus, it's the most affected actually girls. So it really depends on which condition you're looking at. But this is also a reason why it's important to support research in this field. Because then when you can map out which group is affected most, then you can focus the resources there to see if you can prevent and give appropriate treatment. Yes.
Now, based on the figures that you gave earlier on about the number of children who are suffering outside there as a result of these things, this disease, are many children suffering silently without knowing what they have specifically?
That is one of our greatest stumbling blocks. I like to give the example of TB. Everybody from our grandmother in the village to even CEOs in boardrooms, when they hear someone has been coughing for more than 2 weeks, everyone starts having question marks, isn't it? They say, well, you need to be checked. And of course, everyone is wondering, could it be TB? And even when they go to the hospital, if I tell you now, I want to test you for TB and I want to take a blood sample, will you not look at me strangely?
Exactly. Definitely.
You're like, I like the way your team is laughing in the studio. Since when is blood test used for TB? People know you should do a chest X-ray.
Exactly.
And I think you're supposed to produce some sputum. We assess it in the lab, isn't it?
Yeah.
Even you know that.
It's simple.
We don't have that level of awareness for childhood arthritis.
Right.
Because first of all, we are still grappling to accept that children can get this, and a lot more education is needed for the community, for schools, for policymakers to appreciate that the signs and symptoms can be easily identified. The solutions are available, but it's important that they are accessible. Yes.
All right. And talking about accessibility, Daktari, what early signs should parents and caregivers be alert to? I'll
probably mention quite a list of things and people might forget. But the one thing I tell all parents or guardians who come to my clinic, listen to your sixth sense. If you observe something in your child that doesn't make sense, that makes you uncomfortable, please come forward. Let people say you're panicking, you're stressing the health system. It's okay. Yeah. But you as a guardian, whether you're a grandparent, an auntie, a teacher, you felt something was wrong and you came forward. That's when I know nobody will forget that.
That is true.
Yeah. But now, when it comes to the actual science, today, if somebody poured hot water on our hand, or by mistake cut us with a knife, the area where that injury has happened will become swollen, isn't it?
Yeah.
When you touch it, it could even be hot to touch, isn't it? It will be painful, right? Then depending on the skin color, you could even see a change. Yeah, it could be red.
Yeah.
That body's reaction to injury, where things can be swollen, painful, hot. In medicine, we call it inflammation. Okay. When it happens in the brain, we call it meningitis. When it happens in the liver, hepatitis. When it happens in the joints, arthritis. So if you see a swollen joint, this is where I'm coming with this. You come forward. Why is that joint swollen? When a child complains of pain, come forward. Because why is the child in pain? And I really plead, let's not assume the child is pretending.
That is where I was headed, actually.
I could see the question coming. Yeah, because I'm not a pain expert, but pain has got 4 domains. Physical, where there's a problem like what I explained. Yeah. Somebody hurts me with a hot iron or whatever. Emotional, spiritual, and mental.
Yeah.
And because I know you and me have lived some years, I'm sure we have lost a loved one, right?
Yeah.
You know, psychologists and psychiatrists say that's one of the worst pains you can experience.
True.
The loss of a loved one. But I bet you, if I test your liver, it'll be normal. If I test your kidney, it will be normal.
Exactly.
Yeah? If I check your blood level,
normal.
It will be normal.
Yeah.
But you're experiencing the worst pain. So that's why I plead with guardians, please, please, let's not assume the child is pretending until you have come forward.
Okay.
Yeah? So a swollen joint is a red flag. Pain in a joint is a red flag. Children can do certain activities at certain age ranges. For example, a child by around 18 months should be walking, isn't it? Children who are going to school should be able to write. So if you see that your child is not doing a particular activity that they should do by that age, you come forward.
Okay.
Right? So, for example, we have children who initially were crawling very well, and all of a sudden they're not crawling.
Yeah.
So like this young girl who I told you had a stroke at 9 months, what made the mother come forward? She had started standing and walking, and then all of a sudden she couldn't stand.
Look at that.
Yes. You see, so there's not, and nobody hit her. The child didn't fall down.
Yeah.
So the mother just wondered, why is it my child yesterday was standing, today she can't stand? You see, so if they're not able to do a particular activity that they should do for their age, you come forward.
Yeah.
The fourth red flag I'll mention, and it's really key, is if a child has pain that wakes them up at night.
Okay.
That is a red flag. It's a red flag because for us in rheumatology, when we hear that pain that wakes up a child at night, there are 2 things we always worry about. One is infection, and actually, believe it or not, the other one is cancer. Because sometimes the symptoms in rheumatology are a red flag for another problem. Okay. So as rheumatologists, we really work a lot with other specialists.
Yeah.
Because the diseases that we handle affect many systems.
Daktari.
Yes.
Allow us to digest that for a minute.
Okay.
Wow. My dear listener, do you have a question? I'm here with Dr. Angela, all right, to help you understand more about this rheumatic disease, okay? A consultant pediatrician and rheumatologist at the Aga Khan University Hospital.
This is Radio Waumini 88.3 FM. 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 This is Radio Waumini 88.3 FM.
I'm having a conversation in studio here with Dr. Angela Migoa, a consultant pediatrician and rheumatologist at the Aga Khan University Hospital, my dear listener. What is it that you want to know? 0712223385 or on Facebook page Radio Mini 88.3 FM. Mimi nimeuliza maswali yangu yote, daktari amenijibu, sasa leteni maswali yenu. 0712223385. I'll begin with Eunice Ndivo, who wants to know if a child complains of joint pains, Dr.
Yes.
Angela, when should a parent become concerned? Is it persistent fever without infections? Another question is persistent fever without infection a sign? Begin with the first one. When should a parent be concerned? Yeah.
I say any child who presents with joint pain, come forward.
Okay.
Yeah, because it's important we get to the bottom of it. Now, in addition to that, joint pain and inability to walk, you do not have the luxury of time.
All right.
Okay? Because one of the things we're always concerned about is infection. Okay? Joint pain that limits the child's daily activity. And the key job description of children is to play.
Yeah.
That's their key JD.
Yeah.
So if the child is not playing, there's a problem. It's critical you come forward. Yes. So if you see that, and then remember what I said earlier, if there's anything that makes you as a guardian uncomfortable,
yeah.
That's the one advice people never forget.
Yes.
Come forward. Then there was another question about
is
fever.
persistent fever without infection a sign?
Now, that member of your audience is leading me to go into an area which is a Pandora's box. And one of the conditions we also manage is what we call the periodic fever syndromes, or we call autoinflammatory conditions. Now, what happens in this condition? All of us, we have our normal body temperature. This normal body temperature, there's a thermostat that keeps it between 36.5 and 37.5, for example. There are instances where this thermostat is also not functioning well. So then it pushes up the normal body temperature to maybe 40.
Okay.
So when you and me were at 37, these children, they are at 40. So you can imagine they are just persistently hot.
Yeah.
The body is just boiling. All right. These are the children where you're always looking for infection, but there's nothing. They even say trial of TB therapy. Sometimes they have checked HIV 10 times, it's negative, they still say, let's just try.
Yeah.
So those conditions, we call them periodic fever syndromes. And the problem with that is your body is not designed to be always hot. Because when that happens, then, organs begin to burn.
Yeah.
For lack of a simpler term. Yeah, so there's destruction that happens. So if they have a case like that, it will be important to come forward for evaluation.
All right. On the other side, Benson says, a very good morning to you, Bram. Say hi to Dr. Angela Well Explained. What about unexplained swelling or stiffness in the morning?
That is another very key cardinal sign of arthritis. And maybe because of that question, I will go into the two types of pain. And thanks to the audience member for that. The pain of arthritis is typically worse in the morning.
Okay.
But as the day goes by, it gets better. The pain of arthritis is worse when you're seated like the way we are. But as they move and they run and they jump and they play, it gets better. So that pain of arthritis, we call it inflammatory pain. And it often comes with joint stiffness. Then there's another pain that can happen because the alignment of the structures is not as great. For example, in the case of a fracture. If you have a fracture now, the bone is not aligned well. Yeah. If you have a sprain, the ligament is torn. Now, the pain because of malalignment, it's typically worse at the end of the day.
Okay.
All right. And that pain, because of malalignment, when you are seated like now, the pain is better. But when you start moving, the pain worsens. So our colleagues who handle problems of alignment, those are mainly the orthopedic doctors, the orthopedic surgeons. So I think as a guardian, if you can assess and see which kind of pain is it worse in the morning? That's leaning more towards arthritis. Is it worse at the end of the day? Maybe the orthopedic doctors need to look and see the alignment. I think that's the way I would summarize it.
And you brought out so well because, and sometimes it can confuse a parent that you see, umekuja nyumbani, okay, mpata mtoto, amekuwa akicheza vizuri, your house manager tells you, ameshinda vizuri. So there is a very likelihood for you to ignore as a parent.
True.
Okay?
True.
That my child is experiencing some sort of uncomfort.
Exactly. And this is why I talked about ministry of presence.
Exactly.
So you can monitor the pattern.
The pattern,
I mean, let's also be practical. You and me are not marathon runners, isn't it?
Yeah.
Surely, today if we decide to run the marathon like Eliud Kipchoge, people will carry us like a baby because we'll be aching. So it's important we also use reason, right? If you went hiking with your child, mountain climbing, they have never climbed a mountain in their lives.
Yeah.
Likely they're going to have some aches and pains, like you and me trying to run the marathon.
Yeah.
But when you notice a pattern, you can only do that if you're present. Then you'll realize this pain, it's been 2 weeks.
Yeah.
It just comes in the morning. But by lunchtime, this child is hop, skip, and jump. This child in the morning, they are okay. But by the time it is 4 p.m. for 4 o'clock tea, you need to carry them around like a baby.
Yeah.
There's a problem.
Okay. Ministry
Of presence.
That is the biggest takeaway that Dr. you've given me this morning. And to listen to my conscience. Instincts.
Please, don't fight instincts.
Exactly.
It's there for preservation.
Yeah.
It's there to help perpetuation of the human species. I don't know what happens to us as adults sometimes. Sijui tunachanganyikiwa vipi. But let's talk for another day.
Dr. Let's talk about the importance of early intervention here.
Yeah.
How important is early diagnosis in preventing long-term complications like these ones?
In our training, evidence has it that if you're able to start therapy within 6 weeks of symptoms, you are able to prevent irreversible joint damage.
Okay.
That's why coming forward early in time is key. So, for example, if a child had a symptom by January 1st, we have a window period until February 14th to intervene on time to help prevent joint damage and organ damage.
Okay.
That is why early diagnosis and prompt treatment is key. Because then if we don't, then the risk of disability comes in. Yeah. All those other psychosocial issues we discussed earlier on, including one we didn't go into, stigma. This is that family with the child always in the hospital.
Yeah.
All of a sudden, even going for family gatherings is an issue. Yeah, so all those are layers that all these children and families go through. Yes.
Okay. And Daktari, now that you are based at the Aga Khan University Hospital,
yes,
does the Aga Khan University Hospital have a dedicated pediatric rheumatology clinic? So,
really, thanks to the Aga Khan University, since 2016, we've been having a dedicated pediatric rheumatology service.
Okay.
And we've been keeping a database, and we have seen now close to 1,500 children who are battling with these conditions. I think the other blessing about being in the university hospital as Aga Khan, as I shared earlier, these diseases affect many organs and systems.
Yeah.
I just give an example of a child who had stroke. Often we have children who are battling with kidney failure. You see, so I need the experts of the brain when stroke comes in. Yeah, I have had several children, the kidneys have shut down. So I have to call the kidney experts to help me with dialysis. And I mentioned about the psychosocial challenges these families face.
Yeah.
So the counseling team is very important. Another area we forget is the nutritionist.
Yeah.
You know, food is the fuel to the body, just like the way you have got diesel and petrol for the car.
Yeah.
So imagine if you have a car that uses super and you pump in diesel, what happens?
automatically malfunctions.
It malfunctions.
Yeah.
That's the same thing we do to our bodies when we eat junk.
Yeah.
You're pumping into your body fuel that will lead you to malfunction. So in part of our recovery journey for these children, our nutritional team is very key, right?
Yeah.
Because then they guide them on how even aspects of diet contribute to that. And often, sometimes we have to give them some supplements.
Okay.
So that's the advantage of working at the Aga Khan University Hospital, that because the many organs are affected, and we are blessed and privileged in the Department of Pediatrics and across the hospital to have all these experts who then come together for the well-being of the child.
Do you receive referrals from other hospitals?
Not only do we receive referrals from other hospitals, we have had children come to us from as far as Senegal,
Wow.
Mali, Burkina Faso, Somalia, of course our East African countries.
Yeah.
I've even had children come all the way from Canada and even Pakistan, because some, like Pakistan, they don't have a pediatric rheumatologist, but like in Canada, it takes a long time before you can see one.
Wow.
Almost 6 months. So when they come to Kenya, they realize that they can see faster.
Yeah.
And we are not so many pediatric rheumatologists across the world.
It is true.
We know one another, you know. So our catchment area not only is the Republic of Kenya, but the East African region, the continent, and as I've shared with examples across the globe.
That explains how the Aga Khan University Hospital is important and well equipped to deal with such kind of cases.
That is it.
Daktari, on the 18th of March is going to be a World Young Rheumatic Disease Day.
Yes.
Okay.
Yes.
What is the significance of this particular day?
This is a very, very important day for the amazing children we treat, their families, the community, and us in the health fraternity and policy makers, because the World Young Rheumatic Disease Day is celebrated across the whole world on the 18th of March to highlight and promote the awareness and advocacy for these children, to emphasize the importance that children also get these diseases, and that because they get these diseases, it's important to identify them promptly and treat adequately.
Okay.
And for this to happen, we cannot do it alone. We need everybody.
Yeah.
From the children themselves, in the spirit of patient-centered care. You know, now we say no decision for the patient without the patient.
Yeah.
And because children don't exist in isolation, just like you and me, we are not self-made, isn't it?
Yeah.
Our communities helped us reach here. So bringing together the children, their families, patient support groups, healthcare workers, policymakers, and the community at large.
Well said.
Yes.
All right.
Yeah.
And I also understand that the Aga Khan University Hospital is hosting a forum to talk to mark this particular day.
Yes.
Tell me about that.
We are very excited about it because we are going to be hosting the first ever walk in this great Republic of Kenya.
Wow.
To raise awareness for our children living with the burden of the pain and disability of these diseases.
Okay.
And we are bringing in together anyone who is willing to support this mission to Nawakaribisha Sana. They are welcome to join us. We're going to have a walk around the hospital after that. We're then going to have a forum, as you highlighted, where we're going to be sharing with them the signs and symptoms of these conditions and to empower them. What do they do?
Okay.
It's not just enough to recognize, but to empower you. What do you do when you see this, so we can help these children? So they are all, everyone who's listening, they are welcome to join us.
All right, my dear listener, mark the date, March 18th, 2026. All right, that is exactly what you need to understand.
But I need to make a clarification. So March 18th is, I think, a Wednesday.
Yes.
So we're going to have the actual event the preceding Saturday, which will be March 14th, I believe. Yes. So that, you know, even those who are working can have have a chance to join us.
Like Bramwel will be there.
Yeah, karibu sana.
Okay. Doctor, as we are concluding, if there is a parent listening right now whose child has unexplained joint pain, what would you say directly to them?
I would say take time and listen to your child to better understand the pattern of this pain, as we have discussed earlier, and to have the courage to come forward for help. Please don't assume that the child is pretending. Let us work with the healthcare workers on this. But the other thing I would like to highlight is the aspect of prevention. Some of these conditions we can prevent, and the prevention strategies are very simple actually. The first that I'll put top on the list, believe it or not, is sleep.
Okay.
I won't ask you how many hours of sleep you get. That is confidential. I'll be breaching medical ethics. But I want to really, really plead. Those who are listening, if they are running schools, institutions, please allow the children 7 to 8 hours of sleep. You know the leading population that comes to me in my clinic? Children who are sleeping for 3-4 hours in boarding schools, and they are aching from head to toe, and all the tests are normal because they are not sleeping. I give the example of Eliud Kipchoge. Everyone knows a marathon runner. He has a sleep coach for optimum performance. So let us rest enough. If God created the world and he rested, who are we not to rest?
Thank you.
So sleep is key in the prevention strategy. In another forum, we can discuss this evidence. Lack of sleep increases the risk of hypertension, diabetes, obesity, and even cancer. So sleep is key. The second, diet. Please let us be conscious of what we eat and strive to have a healthy diet. Third, bone health. Movement is fundamental for health. Let us aim to have at least 3-4 days of physical activity for about an hour where you're physically sweating. If you can do those, you'll prevent some of these non-communicable diseases like arthritis and among others.
Wow. Dr. Angela, thank you so much for your time. Thank you. Indeed, unapenda watoto, the way you explained.
Thank you for having me and for allowing us to advocate for them.
Okay. My dear listener, that has been Dr. Angela Migoa, a consultant pediatrician and rheumatologist at Aga Khan University Hospital. Remember, the Aga Khan University Hospital is bringing specialized medication or treatment closer to you, my dear listener. And they are offering these specialists in various areas. If you want to see pediatricians, well baby, gynecologist, ENT, all of them are closer to you, my dear listener. And that is why they are urging you to step forward today. Remember, when diseases are detected earlier, as Daktari has put it, they are more treatment options, better outcomes, and quicker recovery. But most importantly, my dear listener, from as low as 10,850,000 Kenya shillings, my dear listener, you can get a comprehensive medical checkup in these clinics at any of their medical centers. So today, walk into the Aga Khan University Hospital Medical Center close to you or give them a call. 07300 11888. Call that number. 07300 11888. The Aga Khan University Hospital, world-class care here and now. I'm taking a break for news. I'll be back with Wakili Situma to talk more about matters employment relations. Don't go too far.
Radio